Your child is having problems with asthma and you may need to go to the hospital. Pediatric asthma is one of the most common reasons for admission to the hospital for children. Let's have a closer look at asthma in children. Asthma is caused by inflammation in the airways of the lungs. The most important triggers for this inflammation are allergens like pollen and mold, viruses, cigarette smoke, and other exposures in the environment that can irritate the airways. When there is inflammation and swelling in the airways, then your child may have a cough, wheezing, chest tightness, and even abdominal pain. If the asthma attack is severe enough to land you in the emergency room or hospital, then your child will be considered for treatment of asthma exacerbation. Common treatments include medications to open the airways called bronchodilators that are given by nebulizer or inhaler with spacer. Oxygen. Steroids such as prednisone that can be given by mouth or intravenously. Antibiotics may be needed if your child has infection in the lungs that can present a cough with yellow or green sputum. The most important task for you as a parent is to learn about asthma, what triggers it, how to tell if asthma symptoms are getting worse, and what medications are most effective for your child. The best test to diagnose asthma in children 5 years or older is spirometry. Spirometry is a test where your child takes in a deep breath and then exhales into the spirometer as hard as possible. One important measurement is the amount of air that your child can force out in 1 second. The measurement is called the FEV1. Then, your child may be given a medication to open up the airways, and the FEV1 will be measured again. An improvement in FEV1 after treatment with a medication like albuterol makes the diagnosis of asthma more likely. Another useful test for asthma is the measurement of FeNO, or fractional exhaled nitric oxide test. If your child is an infant or less than 5 years of age and cannot have spirometry, then he or she may need a trial with an inhaler that has steroids for 1 to 3 months. If the symptoms improve with treatment and then start again after the medication is stopped, then asthma is more likely. Let's have a look at the different medications that are used to treat pediatric asthma and how they may fit into your child's management. Inhalers that contain steroids help reduce inflammation in the airways. Beta agonists, such as albuterol, are another type of medication for asthma. You see, in the airways there are muscles that can cause the airways to tighten or close. On the muscles in the airways, there are little proteins called receptors that tell the muscle where to tighten or relax. One receptor, called the beta-2 receptor, tells the muscle to relax. A medication that connects with this receptor is called a beta-2 agonist and can help the muscle relax that will then cause the airways to open. That's a good thing for asthma. We want the airways to be nice and open. The beta-agonist medications can be short-acting or long-acting. These are called short-acting beta-agonist or SABA and long-acting beta-agonist or LABA. A third type of medication for asthma comes in pill or chewable form, like montelukast. The blood cells can produce leukotrienes that cause inflammation in the airways. Wouldn't it be great if there were medications that blocked the production of leukotrienes? Well, that's exactly what LTRAs, or leukotriene receptor antagonists, do. Next is a medication called cromolyn that helps slow down the body's reaction to allergens. Finally, steroids taken by mouth or intravenously are a last resort for the treatment of severe asthma. Steroids have many side effects and are not used unless they are really needed. For children who have asthma caused by allergies, we need to find out what the allergens are in the environment. If your child has asthma and needs to be treated frequently, then a referral to an allergist may be needed. Let's look at the different steps for the treatment of asthma depending on how severe the asthma is. Remember, if your child has wheezing or asthma symptoms only once in a while, then we call that intermittent asthma. If the symptoms occur frequently, then your child has persistent asthma. It's good to think of treatment in 6 levels or steps, depending on how severe your child's asthma is. Step 1 treatment is for mild asthma that occurs once in a while or intermittently. Your child may be prescribed a simple short-acting inhaler, such as albuterol, that can be used when wheezing or coughing. Step 2 treatment is used if your child frequently has symptoms related to asthma. This is called persistent asthma, and for this, your child will need an inhaler that reduces inflammation in the airways. The treatment used is an inhaler that has steroids at a low dose. Step 3 is for more frequent symptoms and includes treatment with a medium-dose inhaled steroid. At this point, your child should be seen by an asthma specialist. Step 4 treatment includes a medium-dose inhaled steroid plus a long-acting beta agonist or montelukast. Step 5 is an inhaler with high-dose steroids plus a long-acting beta agonist or montelukast. Finally, Step 6 is the same as Step 5 plus steroids by mouth. Your doctor will work with you to determine the best treatment for your child, but it is important for you to understand the treatment so that you can help your child every day. Remember that you and your child need to know how to use the medications, especially the inhaled medications. Your child may need allergy testing to see whether treatment with allergy injections will be helpful. There are many allergens that can make asthma worse, like dust mites, pollen, animal dander, mould, and more. Allergy testing helps determine what may trigger your child's asthma, and allergy injections can help improve asthma control. Remember, the most important task for you as a parent is to be informed. The more you know about treating asthma and the triggers that make asthma worse, the better. Hope your child feels better soon.